Hello, good afternoon. Welcome back to today's teaching. I will be talking about breast cancer and marking the celebration of World Breast Cancer Day. That's why I wore pink. That's the color. So, uh, before we dive into today's discussion, I would like advise women, please make sure you do your self breast examination. All right, and when you are in your bedroom, stand erect. Okay, then you raise up your hands. Okay, or better still, you lie down on your bed with one of your hands at the back. Okay, then use the opposite hand and press your breast in anti-clockwise, clockwise. Then while you are gently massaging, pressing down gently, check for any lump, any movable lump. If you're not comfortable, please try as much as you can to visit the hospital. Okay, so that is all about self breast examination. So while we continue to talk about breast cancer, then what do we understand by this breast? Then when we hear of breast cancer, it simply means an abnormal growth of breast cells. The normal cells in the breast, when they start to develop abnormally, uncontrollably, okay, which raises some concern. So for you to know if you have breast cancer, you need to do some investigations, or maybe there are some signs which were not there, or maybe changes, and which if your body has changed from what it used to be to another, it raises concern. So according to research, 99% of breast cancer occur in women, while 1% is in male. Yeah, some people may be like, oh, does men actually suffer from breast cancer? Yes, we see some cases like that. At least I've seen one since I became a nurse. So then another thing we are looking at today is the causes, or we call it the risk factor, because we don't have any definite cause, but there are some risk factors. At least being a woman, you are at risk. 99% of women are at risk of breast cancer. Okay. Then another risk factor is age. Women older than 65, menopausal women who have entered their menopause, have family history in the sense, if a mother has suffered breast cancer, so the likelihood of the doctor having it is there. So that's the family history we are talking about, or a familiar and genetic factor, let me put it that way.